This is a 41-year-old who has a history of persistent rhinorrhea, headaches, and nasal stuffiness, unresponsive to multiple courses of everything that could be prescribed. Here are the coronal images. This again from our standard screening sinus CT. Further posteriorly. And here are some representative axial sections. So with a representative section here, which statement do you feel best describes these findings? You feel this is an irregular destructive lesion of the ethmoid sinus? You feel that infiltrative changes are apparent with invasion of contiguous structures? The lesion has pansinus involvement with no evidence of bone destruction? Or orbital and CNS disease is present? Please enter your response. Survey says 92%. Very good. You all feel this is a pansinus lesion with no evidence of bone destruction. A very characteristic feature of this disease process is the preservation of individual ethmoid septi. I've heard these referred to, and I think it's a very good term, as ghost cells. They are demineralized, but they're still there. And if you look through the extent of this lesion, although the bone is somewhat rarefied and demineralized, it is still present. Occasionally we do get the appearance of maybe a little more defined contour of some of these lesions. So the next question, which complications of chronic sinusitis include polyps, mucoceles, superimposed acute infections, or all of the above? %. I rule. That is indeed true. These are all well-known complications of chronic sinusitis. This patient has chronic sinusitis and a disease process that is commonly referred to, although the name changes frequently, allergic polypoid sinusitis. Why is this polypoid sinus disease? There is no bone destruction. Modest demineralization is pretty much characteristic, however. Diffuse sinus and nasal cavity involvement, and if you're lucky, you may see discrete polypoid masses when you're evaluating this. These patients' disease process results in essentially any time they are exposed to allergens, their mucosa reacts by making polyps. It's a bad disease to have because until the mucosa is completely denuded, until there's nothing but granulation tissue in that nasal cavity, any mucosa that remains will invariably respond by making polyps. Widening the ethmoids and actually increased sinus volumes overall is relatively characteristic. Distinguish that process from this process, a focal process, and again with irregular bone destruction. So this is not diffuse disease, focal disease. That's always going to raise a different kind of flag for us. This patient with sinonasal undifferentiated carcinoma. Case 5, this is a 38-year-old who has chronic